Okay, good afternoon. It is Tuesday, March 31st, and we've made it through, I guess, nearly three weeks of this pandemic. So I really want to stress, Scranton, you are doing an incredible job. The social distancing is painful. It's painful because we can't be with all of our family members. It's really painful that we can't go about our daily lives. We can't go to work. We can't do the things that we normally do, and it feels awful physically. It feels awful mentally, but we really are saving lives by staying home. So thank you, thank you, thank you for everything you're doing. We've got to keep at it. It does seem to be working. In speaking with the hospitals, the medical community, there's a long road ahead. We don't know what this is going to look like. We have had 3 deaths in Lackawanna County to date, but I think we can cautiously say that number is still in the single digits because we're really working hard as a community to follow these orders and do a good job. So please continue to stay home. Your staying home saves lives. Those empty streets out there, as strange as they look to us, that is a sign that we're doing right by each other and our healthcare workers, our first responders, and our friends and family. So thank you all very much for doing that. The City of Scranton continues to operate police, fire, and public works. As you've seen, if you have questions, if you see a business operating out there that you think maybe that isn't an essential service, we've gotten some of those calls. By and large, people are following the rules, but go ahead and call us at 570-348-4101 or email scranton311@scrantonpa.gov. Please don't call 911 unless it is an actual emergency, but we'll follow up on those emails that you send to us, those calls that you make. We're trying to answer those questions for you and follow up on any of those non-urgent matters via our administrative offices. So with that, we have some updates from the city perspective. We did extend the tax deadline for earned income tax and business privilege mercantile tax. So that is following the federal and state extensions to July 15th. So those taxes won't be due until July 15th, and there will be no penalty charged between April 15th and July 15th. So that piece is there. The refuse bills that go out to you, those refuse bills aren't actually due until the end of the year. So if you are trying to make ends meet and you're not able to pay that bill right now, that's okay. The city needs revenue, so if you are able to pay those bills, please do get that money into us, because we are looking down the road at our budget, and we've already made some difficult decisions. We're going to have to continue to make difficult decisions. So to the extent that you can pay your taxes and can get those fees in, that would be tremendous. We'd appreciate it. But we also understand that this is an unprecedented time for every family out there financially, and we want to work with you. So we really are all in this together in so many ways. So I wanted to make sure that you know that. So of course, the biggest thing that we need to review always, is that if you are sick, seeking medical attention right now, do not just go to the hospitals. Please call the numbers first, and you will be walked through your symptoms and walked through what to do. Now, I say this knowing, as all of you know, the test kits are few and far between nationally. This is a nationwide problem, and it's not something that we think is going to get fixed overnight. So the hospitals here, we are so lucky to have Geisinger and Commonwealth Health here. We're lucky to have services like Ally to help take care of so many other people in our lives here in Scranton. The Wright Center is here. I mean, we're lucky to have so much healthcare available to us. But even though we're used to going to those places to get care, we've got to call these numbers first. So if you are experiencing symptoms, you can call 1-877-PAHEALTH, 1-877-PA-HEALTH. And then the Geisinger Nurse Triage line is 570-284-3657. So again, 1-877-PAHEALTH is 1-877-PA-HEALTH. They can walk you through your symptoms. Or the Geisinger Nurse Triage line is 570-284-3657. 888-858-57. You also can continue to call your primary care physician. And I know that it's frustrating that we haven't been able to get everyone that wants a test tested. Please continue to be patient, and the hospitals are working so hard to be able to get everyone, as many people as possible, the care they need. Like I said, these measures really do seem to be working in Scranton. We aren't seeing so far the numbers that some other communities are experiencing, but the worst is possibly yet to come. So we've really got to keep following these rules and keep patient and keep going by these guidelines to keep the hospitals from getting overwhelmed with folks. So with that, I wanted to answer some questions. So what if you are uninsured? That was a question that we received over the weekend. If you are uninsured, seek care. The Families First Coronavirus Response Act requires that all cost sharing, deductibles, payments, co-insurance related to diagnostic testing for COVID-19 is waived. It includes in-person office visits, telehealth, urgent care, and emergency room visits for testing purposes. So if you are uninsured, still seek care. Do not sit back and think that because you're uninsured you can't get health care. There's so many resources out there for us right now, and it's important that you seek care. So that is one piece that I really wanted to make sure we got across. I wanted to reiterate the mental health piece of this. It's really, really tough out there in your homes, in our homes and in our lives right now. It's hard to stay positive in some moments, I know. So like we talked about on Friday, please take a break from the news. I know we're on Facebook Live. This is the easiest mechanism for us right now to be speaking with you all. But in terms of scrolling through Facebook, that can be really alarmist out there. Don't take everything that's said as gospel. So really be balancing your news sources and making sure that you're looking to the CDC, you're looking to the Department of Health, you're looking to those resources that are trusted and science-based. That's really, really important. And then that diet of news. Just can't do this 24 hours a day. Last night in my own home, we had it on, and I had to ask my mom, like, Mom, I can't do one more minute. It was on in the other room. I could hear it, and I just, we all get to a point where we need to take a break and just try to attack our jobs and our lives in the most productive way possible. And it's probably not a 24-hour news diet. So balance that out. If you do yourself or know somebody that you are worried about in terms of their mental health, the National Suicide Prevention Line is 1-800-273-8255. Again, Suicide Prevention Lifeline, 1-800-273-8255. You can also text TALK, T-A-L-K, to 741-741. That's a free anonymous crisis support system. My team was working on getting me a couple other resources there for you, and we'll get those up as well. But those are important, that we really need to be thinking about our mental health and the mental health of each other. So make those checks on your loved ones. Call people and make sure they're doing okay. This is a really tough time. Everybody is on their own in their homes, and those of us who have families right now, we're very, very fortunate. Those of us who are living alone, that's a tough go. So be calling on those friends and family and those neighbors who are alone right now. So make sure that they're included in your circle of care. Social services, so that's another piece. If your family are experiencing a worry about food, you're experiencing a worry about anything from healthcare to food, to any sort of other resources, if there are things that you're lacking that you need, if you call 211, you can help get connected to services. So call them if you are in need. Maybe it's not food, maybe it's diapers, maybe it's something like that. The resources at 211 can help get you some of those resources. It really is important that you not feel ashamed of asking for help. Right now, there are just millions of Americans. I think last week we had 3.28 million Americans file for unemployment. That was a record by fivefold. During the financial crisis, at one point, around 700,000 people applied for unemployment in 1 week. Last week, it was over 3 million. So right now, raise your hand, ask for help, dial 211 for social services. There are amazing social services in our area, and people are really coming to that aid. There's relief funds out there that are trying to help those services get continue to be funded financially. So don't be ashamed to call those services, even if you've never had to call before. The same goes with applying for unemployment. I want to make sure I give you guys the right unemployment website. So again, individuals laid off in the crisis can file for unemployment benefits. Self-employed individuals are eligible as well. You can get more information at www.uc.pa.gov. The bill that passed over the weekend in Washington, D.C., that federal legislation, allocates an additional $600 a month for 4 months to individuals who receive unemployment benefits from their state. So the federal government is topping off those state unemployment benefits by $600, which is really, I think, going to go hopefully a long way to helping out the many thousands of people in our community that have been laid off during this time. So it's important to, again, don't feel shame to apply for unemployment. This is unprecedented times, and that those resources are there for you. You've paid into those with your own tax dollars, so use them. Okay, a couple more things. Friends of the Poor is doing an Easter food basket giveaway on April 7th from 10 a.m. to 5 p.m. That is at Scranton High School. So again, Scranton High School, April 7th, 10 to 5, an Easter basket food giveaway. It's a drive-through only distribution, and on-site registration is available. Also, the CIC Community Intervention Center and St. Anthony's Shelter are up and running for the area's homeless population. I'd add Keystone Mission to that list. They are screening and IDing and taking temperatures for that population, and we are doing what we can for that population here at the city as well, trying to help everyone who might be experiencing homelessness. A couple more updates. Let's see. Okay, so as you may have seen last night, the governor's order for Lackawanna County to stay at home, what is allowed and what isn't. It's okay to go outside. Just don't be congregating with your neighbors. It's okay to go shoot hoops, maybe you and your brother, you and your spouse, you and your sister. But please do not be playing team sports. The City of Scranton will be putting up some signage and be monitoring that. We've seen some folks having basketball games, which it would be great if we could continue to do that. We cannot continue to have a bunch of guys and gals out there playing hoops together and sweating all over each other. So please, just if you take a court and a ball just with your family, a couple of you, that's fine. But the team sports, we cannot be doing that. That's just that's not a situation where we're playing it safe and helping each other. So please refrain from that. Unfortunately, as you know, we've had to put caution tape around the playgrounds because mostly the playgrounds, those surfaces, it's impossible for us to be able to clean those on an hourly basis at every park. So please stay off the equipment. We really, really want to keep the parks open. So please adhere to the rules that you see posted. Nothing on the playground, no team sports. That way we can continue to keep those fields and courts open, and we can maintain social distance and still have people be able to get outside and exercise a little bit. So that's a big piece of the stay-at-home order. Another piece is, really don't be out going. You don't need to go to the store every day. Try to keep those trips to essential businesses like the grocery store or the pharmacy. Try to consolidate those into a trip a week. You don't all need to go. The whole family doesn't need to go. I've seen some news coverage of some different takeout places that they've been featuring, and I've seen like all the family there, and that's not the point of this. The point is, maybe one person from the household goes out, gets the takeout, is continuing to use sanitizer, wipe down their hands, their car, coming into the house, bringing the takeout in, wipe down the doorknobs that you touched even in your own home. So we really need to be focusing on those guidelines, and that means that not going out as a whole family. So we're really enjoying family time inside, which does bring me to another point that if you I need to get the number for this. I need to get the Women's Resource Center hotline, the domestic violence hotlines. we really are concerned about that right now. I know that Peg Reddy from the Women's Resource Center kind of sent out a call to folks to, if you're concerned about someone, we really need to be raising that because this is a time when uh, avenues for seeking help aren't all available because we're all at home. And so that's something that we really need to focus on. So I will, by the end of the call, we'll get you some information there. If you or a loved one might be experiencing a bad domestic situation, we want to make sure you have the resources there, and that will be an ongoing conversation that unfortunately we have to have. Okay, some other pieces on maybe a little bit. Well, let me update you. Continue on the federal and state bills. So, okay, got it. So Women's Resource Center of Lackawanna County. Okay. Women's Resource Center is 570-346-4671. Again, if you or someone you are worried about it might be experiencing domestic violence, Women's Resource Center is 570-346-4671. That's throughout Lackawanna County and in the whole region. A couple more numbers I wanted to list. So there's a disaster distress helpline, 1-800-985-5990. Also, a veteran crisis line is 1-800-273-TALK, 1-800-273-8255. So we'll get all these numbers listed on Facebook and on the website so that you can see those resources, obviously, after we're no longer live. But I'm trying to get as much information out to you guys and trying, with all of your help, all of your calls, emails, your Facebook messages are really, really helpful to us because it helps us, raise issues we maybe haven't even thought about. I really appreciate the Women's Resource Center for flagging that issue over the weekend. And I have a lot of great staff on my team that's really attuned to that issue. And there's so many things to think through and try to help out in this time. So other issues that you come up with that you're concerned about, reach out to us so that we can try to connect resources and get information out there as broadly as possible. Let's see. Okay, more fun stuff, kind of fun stuff. So the election day, the primary day is now June 2nd for Pennsylvania. So that's been pushed out. Now, while you're home, if you have a few minutes to not be worrying about this crisis response for you and your family, now's a great time to register to vote online. Or not register online to vote, excuse me. There's no online voting. Register online to get an absentee ballot. There are more resources now from the state legislature and the governor signing a bill last fall that really increases ballot access in Pennsylvania. With crisis comes opportunity sometimes, and I think in this way, with this situation, getting more of us registered and getting more people in Pennsylvania to be able to vote at home, vote by mail, could potentially be a real silver lining to this. So go to those resources. Let me make sure I get the right resource for you. We got a lot of information on here, guys. All right, so you can register to vote and apply to vote by mail at www.votespa.com. So VOTESPA.com, votespa.com. Register to vote and apply to vote by mail there. Again, the primary election is moved until June 2nd. What hasn't moved is the census day, which is tomorrow, April 1st. So another thing you can do while you're at home with your family is look around and count how many humans, including babies, are in your room, in your house. Whoever's living there tomorrow, April 1st, that's who should count in the census. We have had a couple questions. Pets don't count, so not your pup, not your kitty cat, just your family. But it's not only adults. It's my 3-month-old is going to count, and anybody living in your house tomorrow, that's the bar. And get that information in. We're just behind the statewide average right now for our response rate. I think we're tracking at 31%. Statewide is 34%. let's get that up there. We're a little bit delayed on having a contest. We were gonna, a few mayors and I, if this ever lets up, we want to have a contest between each other of who can get the best percentage in the area. But let's get that up. Today is a great day to do it. After tomorrow, the Census Bureau will start hounding you. Obviously, they delayed on their knocking on your doors, but mail, phone, and online. We really want you to. There's so many different ways that you can respond to the census. You can make a phone call to respond. You can go online using the code that you received in the mail. I think, where did I put? I put it over here. Just a second. So this is what the mail that you should have gotten looks like. So you got a couple of letters and then you got the postcard. This is what it looks like. There's a code here. That's what you use to respond. And you can, again, phone, mail, get that in remotely. Is something that will take just a few minutes of your time. But now that we're all at home, should be really easy to get that percentage up. So please get that up. Our municipal count committee continues to work really hard trying to figure out how we can help people in harder to reach communities do this. So we're continuing our outreach, obviously, again, not knocking on doors, but trying to help with our outreach. So same thing when you're doing those wellness checks on your neighbors, friends and family around the city, around the area. Mention the census to them. Ask if they're okay, what they need, if they need you to drop a bag of food at their door. Also, remind them to do the census. Help them find the phone number. If they have the internet, help them maybe over the phone, talk them through how to get on the website and respond. It's really important because this determines how much money we get from the federal government. And that's not just for this response. It's not just for the year 2020. It is for the entirety of the next decade. So the better we do responding now, the better equipped we are for the whole next decade here in Scranton and in our region. So please answer the census. With that, I'll just kind of get to a few more items. There are some other, we want to give a shout out to some folks that are doing a great job. Everyone around the community is doing a great job, and we're trying to put as much of that on Facebook. But right now, Zumos is giving free coffee to our first responders, so thank you, Zumos. Posh and Mansford's Market are putting out produce outside of their doors for free, which is great. We have a neighbor, Vanessa, who is posting paper hearts around the city, thanking employees for grocery store, medical personnel, and local businesses. Vanessa, thank you, but please be safe yourself and don't be going out too much, and make sure that you're keeping yourself safe. There's a website and app called Nextdoor. They have what's called a help map. It's a way for neighbors to let each other know if they need help. So it's nextdoor.com/help map. Megan will put that up on the website. That can be a resource for us to match need to resources. So there's a great Facebook group to COVID-19 neighborhood assistance. That's been I've seen really, really lively. There's a Lackawanna County and a Scranton specific group, again, matching need to resources. And I'm just so deeply appreciative and unbelievably impressed with our community. Everybody's doing a tremendous job. Obviously, our healthcare workers are putting their lives on the line every single minute of every single day. So we thank them so much. Our first responders, the firefighters out there, the police officers, our sanitation workers, and the guys that are, fixing things if something breaks and is a hazard in the city. Those city employees are putting their own lives on the line as well. To appreciate them and their families. So let me get to some more questions. LaDonna asked, will residents on Social Security get a stimulus check? Yes. Yes, if you're on Social Security, you will receive a stimulus check. My understanding is that the IRS is to get those out in 3 weeks, I believe. Hopefully they're able to stay on time with that. I know that will really help a lot of us out there. Are the hospitals ready for an influx if we can't flatten the curve enough? So that was Paul in Scranton asking that. Are the local hospitals ready? So I'm in constant communication with the hospitals here in Scranton, with Geisinger, with Commonwealth Health, Regional, Moses, are both part of the Commonwealth Health Network. In talking with them, they have been preparing for this. They are ready for an increase. They are ready for that. Just like any hospital around the region, around the nation, if we see a huge spike, we're gonna really need some help. But they have contingency plans in place. They've been planning for this, and we're so lucky that we are behind the curve in this way than relative to New York City, Philadelphia, and Montgomery County. So again, please stay at home. Follow those guidelines. Use that sanitizer. Use those wipes. Wash your hands more times than you've ever thought you would in your entire life, and be thinking about the risks that are out there. We don't think that we're hoping that we won't see the types of numbers that we maybe are seeing in neighboring regions. But the hospitals are, they think, as ready as they can be. But we really have to keep at this. And one of the reasons they feel confident right now is because our community is doing so well. So that's a big piece. Let's see. So Glenn asked, how can we get Greyhound to stop buses coming into our region? So I was on the phone with Greyhound this morning again. So the woman that runs our region for Greyhound updated me. She said, has the numbers in front of her. There are an average of 5 passengers coming in on the one bus per day that comes from New York City. They have gone from about 150 buses out of Port Authority in New York to 27 a day. They have not stopped service going into other areas. You know, these buses are still going from New York to Boston, New York into Connecticut, New York into Pennsylvania. So they're not stopping the one bus to Scranton, nor do municipal, like myself, local authorities, or even the state authorities have the ability to stop that service. Greyhound is an essential service, labeled essential service by the federal government, but it isn't hordes of people coming in on the Greyhound bus. There are about 5 people a day coming in. There are protocols in place at Port Authority to make sure that people who are visibly sick aren't getting on the buses. I know this isn't as comforting as you would want it to be. You know, if I had my ability to do it myself and, you know, have that stop, I would. It's not in my purview to do that, but I am in constant touch with Greyhound, and those numbers are vastly down at five passengers a day. And like we talked about, and we continue to say, everyone from federal, state to local officials, if you are coming, if for some reason you have had to go to New York City and you are traveling back, you must self-isolate for 14 days. You just have to. It really is the epicenter of this pandemic right now. So if you have to come in, if you're driving your car, which is 99%, more than 99% of the traffic, of course, coming in, it's not Greyhound bus that is the only car coming in from other regions. If you have had to travel to New York City or Philadelphia or Montgomery County, please save the lives of your family members and our first responders, our healthcare workers. Please do not follow these guidelines to self-isolate. Please do not be the one going to the grocery store. Please do not be the one going to the pharmacy for your family. We just listed all those ways that you can flag that you need resources. If you need to self-quarantine, there are people out there that are able to get you that delivery. They can bring that food to your door and leave it for you to pick up after they're gone. So those resources are definitely there. We got a question from, who was it? Danny, asking how he can volunteer to help. There's a lot of different ways to help, but it's kind of shifting who needs what. So if you can email us, scranton311@scrantonpa.gov, or call us at 570-348-4101. We can try to get you to the volunteer base that is most in need right now. Also, the Nextdoor app that we'll post, I think that there's some people out there saying, hey, I need this, and you can volunteer to go and get them, and again, leave that at their door. So those are some ways that you can help. Let's see. Okay, so Estella asked, is there a reevaluation date for these orders? So like we saw last night, we just saw Governor Wolf extend the county by county order to April 30th. He also announced that the schools are closed, physically closed indefinitely. So that's the latest that we have. It's really is rolling as you see it, but let us know what your questions are anytime on those. Lori asked, will property tax deadlines be extended? We are in conversations with the county and the school district about that. We've got to look at that. Like I said before, if you are able to pay your taxes right now, please, if you're financially able, please pay them on time, pay them in advance. We at the city do need those revenue streams coming in so that we can keep gas in the fire trucks and keep our police fully operational. So please do pay when you can. If you aren't able to, and you're getting nervous about that, we're trying to sort out what we can on that. Like I said, the earned income tax and the business privilege mercantile taxes are extended until July 15th. And a resident asked if there's an effort by Scranton to suspend housing payments like rent or mortgage for people who have lost their jobs. We're going to be looking to the federal and state actions to see what we can do on that. I do know if you can work with your landlord, work with your local bank on a person, entity to entity, person to person level to see if there might be some relief there. Start with your landlord, start with your own bank on the mortgages. I do think a lot of banks are being flexible and working with people on that. In terms of a blanket kind of order from the city, we've got to work with our federal and state friends and figure out what that would look like. It's a good question. It's a good question, and we'll have to continue to try to answer that for you. But again, like I know a lot of people who've been in talks with their landlords to figure out what we can do. As we have said before, and it seems like a year ago that we talked about, the utility companies are not going to shut off water, gas, electric in this time. If you aren't able to pay your bill, they're not going to shut you off. That was something that those utility companies acted on immediately, and we are grateful to them for that. That in the last week's, something that maybe would have been a sticking point was taken care of weeks ago. So work on a local or person-to-person level right now, and we'll try to work on that for you. Let's see. So, oops, sorry, I'm using the wrong mouse. Okay. So there is a shortage of thermometers. I know that people have had trouble with those. I saw that there's a question from Sue on there. I've seen on the Lackawanna County, let me get I have it, the Lackawanna COVID-19 Neighborhood Assistance Facebook page. That has some folks on there. That's a good resource. If people are out and they see things like thermometers, they're putting a call out and saying, hey, Walmart has these right now, Target has these right now. That might be a resource to look at. We at the city don't have a surplus of thermometers, unfortunately. So I would look to some of those neighbor to neighbor resources and try to see if somebody's found them there. Or if somebody out there has extras, you can connect with those who need them. So Sue, that is a good question, and I wish that I had a good answer for you there. For vitamin C, that was your other. I don't know of a shortage of vitamin C. I believe that I haven't been to a store in a long time. But I do think that there are certainly, I haven't heard of any shortages of orange juice, grapefruit juice, or vitamin C tablets. Emergency, I haven't seen a shortage of that. If I'm wrong, somebody correct me. And we'll again try to crowdsource it and figure out if there's somebody around who might be selling that, if in fact there is a shortage there. Let's see. Sorry guys, this is a cool. It's cool that I can talk to you this way, but I have to look at all my devices to try to make sure I'm answering your questions. Let's see. Okay. Jen Collins asked if it's possible to check Greyhound passengers for temperatures. I asked the Department of Health and the county, and neither of those entities was able to provide that service. So that is, and we thought about it in our city. I don't want to put our first responders in on the line there. The real ask is, and of course, some people might have this and might not be showing symptoms. So I we really went around and around on this. I don't want to put a firefighter or police officer in close contact with those folks coming off the bus from New York. So please, anybody who has been to New York, please self-isolate, please self-quarantine. I will say though, like we talked about earlier, Facebook and some of these resources can be wonderful. They also can get a little bit hysterical. There are not hordes of people coming in from New York City and overrunning our city. I think right now, when we're all very anxious, sometimes we let our imaginations get away from us. Again, talked to Greyhound today, average of 5 people coming in on that bus from New York. And so please, please, please self-isolate. Please heed those warnings, and please use resources, use your friends, family, or the Lackawanna COVID-19 page, the Scranton COVID-19 neighborhood assistant page. Use that as a resource to ask for help if you need it. That's we got to do is, and we are so together as a community, but please, if you've been to one of those cities, if you had to go for some reason, please self-isolate. Okay, let's see. David on the Facebook just says he just brought emergency in the stores, so that's a good thing. So hopefully that message is getting out to anybody worried about vitamin C thermometers. Like I said, I'm not sure what that looks like. I know that DPHOs had gotten a shipment last week. I'm not sure. Those probably flew off the shelves. So try to crowdsource that, and we're doing what we can at the city level. We were talking to FEMA, which is the Federal Emergency Management, Pennsylvania Emergency Management. We're in touch with state and level emergency management all the time. We're in touch with a range of local businesses that are also trying to source things for the city and for the hospitals. Right now, like we've talked about, the personal protective equipment. Really, first and foremost, trying to make sure that the hospitals have what they need, to the extent that we're okay right now in the city, but we could need some help there. So we're continuing to talk with all of our potential supply sources for city employees, healthcare workers, and then if we are able to source a surplus of thermometers, we'll let you guys know if that's something that we could be able to have maybe a Dropbox for or something like that. So are we going to get the garage? Okay. I believe, are we going to get the garbage invoice? So yes, the garbage bills should be going out on time. Like I said, you do have the ability to wait till the end of the year. If you can get the bill paid when you receive it, we'd appreciate it. But like we said, we're understanding, and we're trying to look at all the revenue streams that we're supposed to get. They aren't looking good right now, but we are going to do everything we can to protect the finances that we know are coming in, so that we can make sure police, fire, public works are set for the long haul. That's the most critical piece of that in terms of city management. And I acted aggressively a few weeks ago on that, and it was necessary because we're seeing now what this could look like in terms of lost revenue, both in 2020 and then of course going into 2021. So we have a lot to do in terms of city finances. I'll be getting on the phone after this with DCED, which is the statewide agency that runs Act 47. We're speaking about that, going through the different financial pieces of that, and just trying to keep working this in every single way that we possibly can. Let me just make sure I haven't forgotten anything. Okay, great. There's a number you can call if you have questions about unemployment. It's 1-888-313-7284. So if you need help or have questions about unemployment, 1-888-313-7284. So again, we will get all of these different resources and numbers up on Facebook, on the website, and make sure that information is available. We are trying to get this format. We're trying to figure out a way to get a telephone line in here that you can also call in. We're doing so much on the fly with a very lean team and lean resources at the city. We're trying to do everything without incurring more cost. So We're trying to get a telephone line in. We did some research, and the fancy teletown halls that you get at the state and federal level, those are services already paid for at the federal and state level. The city doesn't have that luxury, so we're doing what we can. We are working to try to get a telephone piece because I know not everyone uses Facebook, and I'm not trying to be an advertisement for Facebook in any way, but it's proving to be at least helpful for the time being. We're going to do this every Tuesday and Friday at noon. So I'll continue to update you all as best I can. Continue to thank you. Continue to show my personal gratitude for everyone out there, from the healthcare workers to the policemen to the firefighters, policemen and women, excuse me, the firefighters, to all of us, all the business owners, the grocery store owners. I want to shout out to Joe Fazula from Garrity's. He's done a tremendous job mitigating this crisis and getting us the food that we need, and helping his employees stay safe. So thank you to all those business owners that are really going through a tough time. Like I said a lot of times, I'm the wife of a business owner, so when he comes home at night, I'm also living and breathing the small business side of this, and it is really, really challenging. And I want everyone out there to know that those business owners are doing everything that they can to do right by their employees and their customers. It's so challenging for all of us, and I'm just deeply appreciative to everyone. So I'm appreciative to all of you. Thank you. There's a city council meeting tonight. It's at 6:30. It's on YouTube. So they have been taking questions, and I'll have Megan put that up on the website too, the way to submit questions for tonight. But I'll be there. There's a caucus at 5:45, and then at 6:30 is the meeting. That's all going to be streamed on YouTube, so you can tune in. I'll be speaking there as well, and we appreciate the City Council for continuing to find creative ways to stay active. So thank you all so much. We'll see you back here Friday at noon. All right. Stay safe and stay home. It is working. So thank you.